Hi, everybody. I'd like to welcome everyone to the Board of Health meeting for Ashland, Massachusetts, the July 20th, 2021 meeting. Just a disclaimer, this agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. In a typical order, any citizens' participation? I don't see Mark DeSoni.
Mark has his hand up.
Oh, he does?
Yep.
Why am I not seeing him? Okay, Mark, go for it.
I'll go for it. Good afternoon. Good afternoon. And John Burns, welcome to the board.
Thank you, Mark.
And the past board member, Mr. Raha. Wish you were back, but then again, we know the situation with you. But it's okay. Everything in this town is going swimmingly, hopefully, Mr. Ed Berman. I appreciate everything you do. You did a well job, and everything goes. And to the whole new board, we'll hope we have a good, healthy rest of the summer. And Diane, don't have to mute because I'm behaving so well that I can mute myself right now. Thank you.
Thanks, Mark. KG, you have anything you want to add from what you had stated to me? I think that's a good idea. Why don't you kind of bring it up in citizens' participation?
That's right. Welcome, John, for the Board of Health. You're a good addition to the board. Thank you. And I had sent an email to Ron about the town of Concord going all of the permits for the Board of Health online. So he said he would try to get that through the board someday or the other. So
yeah, well, we
Ron.
can, maybe get it on the next agenda, if you can get me a little bit more information.
So if I can just add to that, just because, the town's in the process of a very large undertaking of getting all permitting under one umbrella. So it might even be a capital project, I'm not too sure, but it's for every single department. So I think we should wait till the town IT department makes their presentation to the town manager before we decide to do something differently. Right now, the building department uses one system. In general, we would use another. Fire department uses one, and so forth and so on. So they're trying to look at everybody using the same system, and it is a large ticket item. So of course they're scrutinizing the programs and so forth. So just want to throw that out there. Okay.
All right. Thanks, Di. That's good information. So, okay. In case everybody doesn't know who's out there listening to tonight, we have a new Board of Health, Jay or John Burns. So we thank you for your interest in the Board of Health, and we know you're going to make a great addition. And thanks for your time and effort. We can certainly use the help.
Thank you.
Yeah, and we know your wife is to me also functioning in a big capacity that I really consider a board of the arm of health. She's been a major player in the decisions at every turn group, which is just a phenomenal just separate entity that I think does a really wonderful service for the town of Ashland, and obviously particularly the youth in helping to curb or discourage or prevent use of alcohol and drugs for our teenage and kids. So it's a really great thing. I personally try to go to their meetings and see them. Usually I get to most of them, and it's just a really good organization.
Yeah, that's great feedback, and I will pass it along. It's good to hear it.
Yeah, I think they know that. The whole group, basically won our award for our Mary Mortensen Award, last year. So, you know, they do a lot, and they're highly respected, certainly, you know, in town, and certainly respected and acknowledged by the Board of Health.
Mm-hmm.
Yeah.
Thank you.
So, okay. And that brings us to Superman. Mr. Ed, what do you have for us?
Hi, everyone. So I know we haven't met for a few weeks. So we did have, you know, we had a little week lull. We had no new cases come in. And then we kind of got hit with 4 cases. So when I looked at the 4 cases, which those came in 2 weeks ago, they just cleared. What was interesting about the 4, none of the 4 had been vaccinated. But none of the 4 got really sick. You know, they had, you know, symptoms, but nothing bad. Now, those cleared, and currently we now have 3 basically new cases that came in. What's interesting about this is 2 are in one household, both vaccinated, with full vaccine. Symptoms, both have symptoms but are mild. And the third person is in a separate house, only received 1 of the 2 vaccines. You know, and one of the things that I also like to stress to people too is that, you know, on a given year, when people are getting the flu vaccine, you know, that protects you at about 60%. So you still have about a 40% chance of contracting the flu, but usually people that got the flu shot and still get influenza do not end up being hospitalized. So I like to stress that. And with the current COVID vaccines, you know, your protection is at about 94%. So you still have about that 6% chance of getting COVID. But the other interesting thing is nobody that's been vaccinated that has gotten COVID in Massachusetts has had to be hospitalized. So good note there. In our categories by age group, as you all know, we're part of a 7-town collaborative. The one area that we are the lowest in is our 20 to 29-year-olds. Right now, I think we're at 61%. Let me just check the chart real quick. It was sent out to everybody. Yeah, we're at 61%, which is a little bit lower than our other 6 towns that we're part of our collaborative with. They're in their high 70s, low 80% in that age category. So we have a little catch up to do there. And again, you know, I know a lot of the public listens. You know, if anybody is having difficulty finding location, which they shouldn't, you know, they can certainly reach out to us at the COVID hotline, and we can help them find an appointment somewhere. And that number is 508-532-7900. Also, Raj and I this past week, I won't mention any names, we were dealing with some parents from daycare in town that has made the decision basically that if people don't want to wear a mask in the building, they don't have to. According to the EEC guidelines, which came out also, that EEC is what licenses daycares in Massachusetts. They basically said, yes, we're not mandating it, but it's still recommended for anybody that's not vaccinated, which obviously would be that age group. You know, we spoke with the directors at the facility, and, you know, we said, listen, you know, we would still recommend, you know, that these kids wear a mask indoors. You know, and Raj and I have kind of been fielding some phone calls from parents and kind of explaining, you know, our position and their position. And it seems to have settled down a little bit. I think as the week goes on, we'll see. So I believe in the fall, the plan initially was DESE was going to say no masks in the schools. I think that's now going to possibly be changing again because of the uptick in cases. Yesterday in Massachusetts, there were 771 new cases, which is a significant increase because we went from 0.6% across the state to 1.8% positivity rate, which is a pretty significant jump in a couple of days. One of the things that the state is doing is anybody that was vaccinated that tests positive, if they did get a PCR test, they are checking those for the variant, any type of variant, and they're supposed to let us know. We have not heard anything from our current 3 cases. So my quick update, unless anybody has any questions.
I have one, just as far as a lot of misinformation with regards to people not getting the vaccine. Are you getting a lot of that? Are you able to dispel, some of the, misinformation or rumors, that are going around?
Yeah, I mean, we do get a couple calls here and there. Do I call them conspiracy theorists?
Whatever it is.
Honestly, not to make everybody laugh, but I did get one phone call where the woman, thought we were injecting a locator device into people, and I had to tell them, ma'am, that is not true, and obviously it's an individual decision. I was vaccinated. Everybody I know has been vaccinated, and nobody's had any issues with it. I mean, I don't know. And I think it's funny, you go to other, we were just on vacation in Georgia, and I don't think anybody's vaccinated there.
Yeah. I won't disagree with that.
Yeah. I understand it's an individual decision, but if people have any questions or concerns, and they can certainly call us. Call your primary care physician if you have a good relationship with them. Discuss your concerns with them.
Right.
Other people in the community that are healthcare providers.
Yeah.
Again, I don't know where we're going. I mean, we're seeing an uptick all of a sudden again. I don't know where we're going to be in a couple of weeks.
Yeah. Yeah, I'd read an article not too long ago that at least the infection rate with pockets of people that haven't been vaccinated is exactly the same as it was more in the height of the pandemic, although the overall rates would go down just because of the people that are getting vaccinated. So it should prove to people that think there's an issue with the vaccine that the only reason we're where we are is because of the relatively large percentage of people that are getting vaccinated, because
Right.
That's slowing down the spread, even though you can get it. The point that you made, I think, was a great point to bring up for people to realize is that it doesn't mean you can't get it, although your percentages are less, but the risk of having a serious case that's going to potentially be life-threatening is minimized. And
Right.
so far, at least by your report, not existent. It doesn't exist in this state. So that's
Right.
great information for people to know.
And just for also, I'm knocking on wood, by the way. I'm knocking on my wood table. I was vaccinated in January as a healthcare provider, and I took care of many, many people with COVID, and tested a lot of people. And, obviously I was exposed quite a bit, and I did not get COVID. I am knocking on wood again. But I really feel it was most likely due to the vaccine.
Yeah. And wearing
wanna-
masks. Yeah, please.
Sorry, Dr. Ron. So I
No, go
did
ahead.
a very important stat today. CDC have come up with 99.5% of deaths in US right now is from unvaccinated people, so that says a lot, so 99.5% of deaths are coming from unvaccinated people.
Yeah, that's an incredible statistic. 99.5.
Right.
Amazing.
That's right.
And again, and I encourage people with questions, to please contact us. If we don't have the answer, we'll find it for you.
Yeah. Okay. Thank you.
You're welcome.
Diane, John, Bernadette, anything to add? No?
Nope.
Okay. All right, Sergeant Berman, thank you again for all your help and your report. As Diane would say, you're certainly welcome to stay on, but you probably have more important things to do. But you're welcome. So we'll move on to the number 5, which is a septic waiver request for 579 Chestnut Street, is I can't see at least Tom on my computer. Is I'm on a little iPad. Tom, are you here?
I am here.
Hey, Tom. Oh,
Hi.
now I see you. Hey, how you doing?
Hi.
Hi. You want to give us an overview of this and let us know what's going on?
Ron, the engineer is, I don't know if you can see him, Ron, Eric is on, who is the engineer for the project. I don't know if you want him.
Yeah, but
He's having a hard time seeing everybody. Sorry, guys.
Oh, now I can see him. Sure, go ahead, Eric.
Okay,
Good. How are you?
good. Let me go back here. So do you want me to share my screen?
Yeah, Laura can do that.
Yeah.
That's great.
Hold on.
Okay.
Sorry. Should have had that ready.
Sorry, Tom, I didn't mean to cut you off. I figured Eric probably should do his overview first.
Yeah.
Tom can go for it.
Okay.
Thanks,
Eric.
Diane. I appreciate that.
All
No worries.
Okay, Eric, you're a co-host, so you should be
Okay.
able to. Thank you.
Okay, there we go. Okay, this is 579 Chestnut Street. If you're not familiar with it, it's if you go by the Warren Conference Center heading towards Holliston, it's on the right. It's a big stone mansion. I don't know if you've ever seen it, but it was a little history of it. It was built in 1925 for the president of the Boston and Maine Railroad, Homer Loring. Anyway, it has a failed septic system. It's quite a property. It has a cesspool on the backside, right where I'm showing the septic tank there. All in the backyard here is just gardens and terrace. There's a greenhouse, a wading pool, a couple of stone garages. It has a terracotta roof. I don't know if you've ever seen that, but anyway, given the soils in the area, we decided to test and to maintain the property. We tested down here. We did end up with high groundwater. We were not able to run a percolation test, so we sent the soils off to UMass. Came back as a sandy loam. In an effort to make the system work by gravity, we designed an Elgin system. It's a DEP approved alternative technology that lets us go closer to groundwater and make the overall leach field or soil absorption system smaller. However, given with that type of technology, there are several waivers that we are requesting. I can go through them if you'd like.
Please.
Okay. Given the wood, and I should have mentioned earlier that there is an on-site well right here, so we couldn't have gone into that area. That's a 100-foot buffer. We stayed out of that. It's also it has very mature vegetation along the borders. We tried to preserve that as best we could. So the first waiver we are requesting is for a garbage disposal. If we were to size this for a garbage disposal, this system would have been 1.5 times larger, would have taken out a lot more trees. And currently the house does not have a garbage disposal, and there's no intention of installing one. The second waiver is a distance between the trenches. With an Elgin, it can be 6 feet. The Ashland regulations require 10 feet. So we're asking for a waiver to go from 10 to 6. And then we get into the local upgrade approval. The DEP allows this system to be 2 feet above groundwater versus 4 feet due to its secondary treatment. However, it is a request, waiver request. And then due to the high groundwater, we had it at 36 inches below grade. This tank between the inlet pipe and the outlet pipe has less than 12 inches. So that's also a request. The tank will be sealed and we will ensure that it's watertight. So there will be no leaking of groundwater into the tank or seepage. And then the last local upgrade approval request is that the system be designed, which it was, using a sieve analysis versus a percolation test. When we dug to do the percolation test, I should have mentioned we had groundwater coming into the hole, so we couldn't run the test. So we, like I said, we sent the soils off to a lab. And that's about it.
Okay. Any board members with any questions? All right, I just at least one.
Yeah.
It's just as I'm fine with it. What's the difference with adding the garbage disposal? Why would you typically need to make that significantly larger?
They say that the food particles pass through. A garbage disposal doesn't grind the food up fine enough. And what it does is it passes through and gets into these trenches, and the progressive failure starts earlier. So
Okay.
so they'd like it sized larger to accommodate for those food particles that make their way into that field.
Do you see that as an issue with these things ever, or is this newer technology kind of mitigate that to a degree anyway?
I don't see it as an issue. I mean, you mean by not designing a garbage grinder, do we, and then having someone put one in? Is that, or do you, what do you mean by your question? Like, do I see it?
I just mean you don't think that they're going to still have to clean this thing regularly anyway. So you don't, obviously it's not going to be an issue with doing that.
Right.
No,
I don't think there'll be an issue.
Okay.
We are requesting that they follow the Title V, which states that you should pump your tank every 2 years.
Right.
Yeah. So
okay.
Hopefully they follow that.
Yeah.
Other than that, the Elgin has no additional upkeep over like a stone and pipe type system, like a traditional system.
Yeah.
There will be a deed restriction on the property, though, that limits the home to 6 bedrooms, which it is now. There's no increase in bedrooms. If they were to add another bedroom, which I don't know why they would, but they have to replace that system with a traditional system, and it would be a lot taller, in height, and it would be larger.
Okay.
Eric,
All right.
sorry, I just want to make sure I understand that. So is that the 310 CMR 15.405 that they are not allowed to add any square footage, correct?
Yes.
Okay.
Well, I believe they can add square footage. They just can't add a bedroom.
Okay.
Yeah.
And okay.
I think if you look at my on the list of variances on the second page, Tom probably caught this. I accidentally typed 7 bedrooms. It's really a 6. So
yeah, everything else had 6 on there.
Yeah.
So the code is 15204 actually prohibits increases or change of use of facility unless it's approved by the Board of Health to upgrade the system. And then 405 is the actual local upgrade procedure.
Okay, yeah, so on our section 3 on page 2, it does not say 6 bedrooms, but it also doesn't say, it says no increase in design flow. I just want to make sure that when I phrase the motion, I'm not adding something that shouldn't be there, because we're going to require a garbage disposal because of leaching trenches under our regs. And then we would also say no increase to flow.
In design flow?
Is that the condition for section 310 CMR 15.405?
No increases in design flow?
Yes.
That's a question. I just want to make sure I don't put a restriction on it that's not per code.
True.
Okay.
Right.
You want me to take a whack at it, Ron?
Yeah, I'd love to.
Okay. And just quickly, just because we do have a new board member on, I just, Ron, if you don't mind.
Sure.
Jay, we are calling him Jay, just to let you know, just to give you an idea, just so you can follow along as well as participate. So what I'll do is I'll make a motion, go through this and make a motion, and we need a second for each motion, and then we'll take a vote for each member. And what we do is we just say, we all say Diane, I, Jay, I, so forth, and then we'll move on to the other ones. So, so I'll go through and I'll make the motions, and I think, is Barbara on? I think I was gonna say the other members are also here. So we'll go through them and then we'll just ask for a second for each motion.
Okay.
All right. I make a motion for 579 Chestnut Street for section 303-11 and 303-14 from the Ashland Board of Health Regulations to not design for a garbage disposal with their deed restriction stating no garbage disposal is to be installed while the septic system is in use, and allow 6 feet from wall to wall between trenches. Can I get a second?
Second.
Thank you.
Great. Okay, all in favor?
Diane, I.
Ron, aye.
Jay, aye.
Benedict, aye.
Okay, that's great. So Barbara, are you here too?
You can
Oh
see
my-
me?
Oh my God, no, because we have the screen. Okay, so that's a 5-0. Okay,
All right.
great.
Okay, the next motion is for the Title V local upgrade approval, 310 CMR 15.284 to allow 2 feet above seasonal groundwater, and 310 CMR 15.405, reduction between, reduction requirement 12 inches between the inlet and outlet tee, and 310 CMR 15.405 to allow the system to be designed based on a sieve analysis with a deed restriction saying no increase to bedroom count. Can I have
A second,
thank you.
anybody?
Second.
Second, okay, great.
Mhm.
All in favor? Aye, Ron.
Diane, I.
Benedict, aye.
Jay, aye.
Barbara?
No. Aye,
You-
Barb.
You good? Okay, aye, okay. 5-0, that passes.
Yeah, volume not too
Yeah.
good.
Thank you.
Okay, thanks, Eric.
Okay, thank you, guys. Take care.
Yeah, thanks, Tom. All right. All right, we can move on to the waiver request for 58 to 62 Waverly Street. So I have that here, and I'm sorry. That's
Dan McIntyre, representing
Dan?
the homeowner.
Yep.
Yes,
Hey, Dan. How are you?
good.
I made you a co-host, Dan. So you should be able
Okay.
to. Thank you.
Thank you, Laura.
Thanks, Laura.
Can everyone see that?
Yeah.
Okay.
Yep.
So this property is located right on Route 135. There's actually 2 properties that are owned by the same person. There's the 58 and 62 Waverly, which is on the street. And then 64 Waverly is kind of a back lot. The yellow line represents the property line between the 2 properties. So they've got 64 has a little driveway entrance here, and that's a single family home. 58 to 62 is a 3-unit apartment building. There's 2 2-bedroom units and 1 1-bedroom unit for a total of 5 bedrooms. And the owner is looking to sell this off right now. So we've been retained to design a new septic system. It's currently served by cesspools that are located on the 64 Waverly property. You'll see these 4 circles back here. These 2 serve the apartment building, and there's a pipe coming up through an easement up to that building. And then 64 Waverly is served also by 2 cesspools. You'll be seeing a design for this one shortly. We're working on that right now. But right now, 58 to 62 is on the market for sale, so we're trying to get this one done. We tested in the backland over here and found some suitable soils for a septic system. So we're proposing conventional stone and pipe trenches in this area to serve 5 bedrooms. The tank is located right here. And we're looking to put the pipe again across the 64 Waverly property in a new easement that's going to be created. And then this easement that currently exists for the cesspools will be gone. So Cornerstone Engineering did the survey for this one and created that easement. The homeowner retained them to eliminate that easement and create a new easement here. So that work is in progress now, but not complete. It's served by town water, so there's no wells involved. So other than the easement issue, it's fairly straightforward design. We are asking for some waivers to the ashland regulations, some of which we just discussed with Eric. We're looking for the garbage grinder waiver. We put in a 2-compartment tank, which would be part of the garbage grinder design, but we really don't have the space to increase the leach field by 50% for that. So we're asking for that waiver. We're also asking for the waiver of the 10-foot spacing between trenches. We're proposing the 6-foot trench spacing allowed by Title V. And also we're asking for a waiver on the 2 percolation tests. We actually did perform 2 percolation tests. One's on this property, one's on this property. We tested them both the same day. Fairly consistent soils all the way through here. So we're very comfortable with the perk rate, but we only did 1 in this area here. So we're asking for that waiver.
Okay.
So with that, I can open up to questions.
Anybody on the board?
Dan, just for curiosity, do you think that they're going to sell the front property before they construct this new system? Are they going to need a construction easement, or is it they waiting until the easement is?
Well, I think they'll get the easement done. They probably will sell it before it gets constructed.
Okay. So it will be a construction as well as a maintenance easement? Is that how it works?
Yes.
Just more curious. Okay.
Yep.
Okay.
Thank you.
Any other questions?
No.
No? Okay. Diane, since you're pretty good at making these motions, you want to take a stab at this one too?
Absolutely.
Okay.
So
Thank you.
I would like to make a motion to grant 58 to 62 Waverly Street variances from Ashland Board of Health Regulations 3037, allowing 1 percolation test, 30311 30311 to design without a garbage disposal with a deed a deed recording stating that no garbage disposal is to be installed while the septic system is in use. 30314 trench spacing 6 feet allowed versus 10 feet.
Okay. Anybody like to second that?
I second it.
Okay. Thanks, Bernadette. All in favor? Aye, Ron.
Hi, Diane.
Hi, Jay.
Hi, Barbara.
Good. Bernadette,
Yes.
you good too with this?
Oh, I said I second
Yeah.
it.
Oh, yeah, I know you second it, but we still have to take a vote,
Okay, aye.
so I figured you would, but okay, thank you. That's official now. All right. 5-0. Okay, great.
Okay.
All right, thank you.
Thank you very much.
And yeah, so
Thanks,
that should be it. That should be it for that. And we have, okay, so moving on to 7, animal waiver request for a second pony at 36 Larkridge Lane. Mr. Hoffman. Diane, was this something that you were was this kind of in your purview today?
Well,
Or not-
I mean,
or
I
not
know
really?
I know Dawn is not on, and I know
Okay.
as some of us know, as Dr. Hoffman is on, in the Hall
Yeah.
family, but I just a little history just for the new board members.
Yeah.
We granted Richard Hoffman as well as the Hall family a animal permit to have a pony. I did go by previous to them bringing the pony in just to take a site visit because it is fairly close to me. They did an awesome job clearing out, and so anyhow, so I talked to Donna. The Halls were interested in bringing on another family member, it sounds like, to keep this one company. I'm by far an animal or pony expert, but my understanding is that they're better off in a pair. I know Donna is out on administrative leave, so Donna did send in notification. I don't know if everybody saw it, recommending approval based on her inspection of the property. So with that said, if the Halls or the Hoffmans want to say anything, just wanted to give a quick update on where we've been.
Thanks,
Can I
Diane.
speak for a second, if I can, Madam Chair? Thank you, Board of Health. Again, I understand your position. You certainly don't want to be making multiple waivers over multiple years. I understand that. And we came before you, I think it was late April, I believe. And we appreciated that very much. Again, I'm the property owner. My son-in-law, my daughter and son-in-law live at the property in Larkridge Lane. And everything's going great, but the horse, believe it or not, seems a little depressed. So the family is thinking of getting a smaller pony to keep it company. And I guess this isn't unusual. I don't know much about horse. I know about education, but not much about horses. But the horse is a little lethargic, and the family just wants to at least consider that option if the board would approve a second waiver. So I'll let Robert Hall speak to that if I can, Madam Chair, and I'm here for questions too. Thank you.
Great. So our original plan was just to get one pony. We actually adopted a pony from down in Pennsylvania. It came from the Amish. That being said, the pony's always been around other ponies and other animals. So when we brought her back here after being quarantined and everything else that had to be done, now all she does is wander the fence line. She's calling out, which after the thing, my mother, with me being raised with horses, horses are herd animals. So they're always used to being with other animals. So our hopes were to try for a mini, which is talking a pony that's maybe 32 to 34 inches tall to its back. Just a little one just to keep it company, to try to calm it down a little bit and see if we can make it a little bit easier for it out there.
Just again, because we do have some new board members on, so our current animal regulations, we did have to give a waiver for the first one, and we would be required to give a waiver for the second one. The waiver would not be specific to size. It would just be to allow a second one. And again, just to let all the board members know that Donna and I are in the process, and it's a little bit later on, the next actually agenda item is we're looking at updating our animal regulations to accommodate things like this. So we would not continually be giving waivers to people. Apparently there's a lot of discrepancies in our regulations to accommodate this, because there's, I believe even sheep, I think, or something, goats, excuse me, not sheep, goats are the same thing, they're in pairs. So we're trying to bring our regulations up to date to accommodate some of these standards.
Thanks, Diane. So I'm just interested. When did you kind of start to notice this behavior from the horse?
So it started off when we first got it, and we were hoping with time that it would actually calm itself down and get used to being alone, and it hasn't stopped at all.
Yeah.
My daughter's actually first thing in the morning, both my little girls go out there and they spend most of the day with her trying to keep her company. And so she actually wanders like paces around the outside fence, almost nonstop neighing and calling out, stomping her feet, like basically looking for another animal to be around her. Something to know it's around there.
Boy, it's just sad to, to know that that's going on.
Yeah.
Yeah, really is. Raji, do you have any concerns?
Dr. Ron, thanks. So I did speak to Donna also, I have not been to the property, but I have seen a picture that was attached to the document.
Yeah.
And we'll go with Donna's recommendation,
Okay. Yeah, I mean, personally, I'm all for it. Would anybody like to make a motion? Guy?
Okay, I can, okay, I'd like to make a motion for 36 Larkridge Lane to allow, I'm just gonna put it together. I'm thinking just putting it together.
Okay.
To allow the property owner to house 2 horses at 36 Larkridge Lane, which is a waiver is 8.1 of the animal regulations.
Anybody like to second that?
Second.
Are they
Okay, great.
horses
We
or
have a-
ponies? They're ponies, right?
Ponies, yes.
Yeah,
Okay.
yeah. Yep.
I said that, just for clarification, I said that the reason why is because our regulations don't say, I apologize, I don't have them right in front of me, but I don't think it says, it actually just says equine. So
Right.
I don't know if we can, based on our regulations, say what size they are. So that's
Oh,
why
okay.
I should say equine.
Right.
No, that's fine.
Yeah, the only reason we're asking is we have the space for 2 ponies. If it was a full-size horse, we'd never ask this. It's just not enough.
Well, I mean, I can modify, because, I can modify my motion. I guess let me just scratch that motion, because if we don't have a second, we don't carry the motion forward. So I'll just rephrase that. So I'd like to make a motion from 8.1 of the Ashland Board of Health Keeping of Animal Regulations to allow 36 Larkridge Lane to house 2 ponies.
Okay. Anybody want to second that?
Second.
Okay. All in favor? Hi, Ron.
Hi, Diane.
Hi, Barbara.
Hi, Jay.
Hi, Bernadette.
Okay. Very great. All right.
Please
Thank you.
let us know if it works.
Yeah.
I hope it
Yeah,
does.
please.
Thank you very much.
Do. We're all pulling for honey. That's for sure. Yeah.
Well, thank you all so much. And really,
Yeah, good.
Buddy did a great job on the paddock. I mean, it's as large as he could make it, still staying within his property, obviously. And the neighbors have been fantastic, super supportive, but it kind of wants an animal for a friend. That's the problem.
Yeah.
So.
Yeah, well, it's a beautiful area, certainly by those pictures I see, and it's a shame for, anything to be unhappy, but that's tough to be unhappy in that environment. So yeah, get her a friend, and hopefully that does it.
Thank you very much.
They're looking into rescue animals too. So.
All right. Oh, okay.
Perfect.
All right.
Thank
That
you
sounds
so
good.
much. Great to see you all again.
Thank you.
Bye, Diane.
Take care.
So,
No,
so interested, leading, into number 8, review of regulations of the Ashland Board of Health relative to keeping of animals. Di, you want to do your thing?
Yeah, so
Okay.
I know I just said it a few minutes ago. So, our regulations are very antiquated, and I know this is something that we've kind of all talked about, is updating all of our regulations to make sure they're, up to today's standards for multiple different levels. Donna, our animal control officer, she is also our animal inspector, researched a couple of communities, and she likes the city of Framingham's. So myself and Laura reformatted them, made some minor changes to them. I believe Laura sent them out to everybody. In general, the regulations are more specific about what they're required to have for housing. And again, I am not a farm animal expert, So I went by, Donna's recommendations. So I just wanted to make sure that everybody takes a peek at them. And what usually happens when we have regulation reviews from the board is we present them like you have tonight, give everybody a chance to look at them, digest them. And if you want to do any research, there's some different information in there where the information came from. And then maybe at our next meeting, we can have another discussion about it and see if anybody has any changes, any updates, any thoughts, any concerns. And once the board collectively agrees that, yes, this is a draft that we want to move forward with, at the following meeting, we would just, we would do a public discussion. We're not required by law to put it in the newspaper or notify anybody, but of course we have a public discussion. Anybody from the public that wants to come and put their input in. It's not going to change our current animal regulations. It's going to be from the date that we adopt them forward. So again, once we have that public discussion, if people come, voice their concerns, comments, they love them. Usually we take that into consideration. And then after that, the next meeting, the board gets together again and hopefully approves what we had in front of us. Of course, if during that public discussion, the board can deliberate and make changes to the regs, and then we have a final draft in front of the board at the next meeting. So you can tell it takes a couple of meetings to get this down pat, but we want to give everybody the opportunity to look at them and to make comments or again do their own research. So from here, I just like to ask Ron for the next meeting, whatever date we pick, is if we have it on for a board discussion and just everybody's thoughts and feelings. And again, I just because we're all new together, we cannot have a discussion outside of a public meeting. So that's why we have to have these meetings posted and for the public to talk about them. So if you do have any concerns or questions that you need answered, Raj or Laura can answer them directly for you. And then we can hopefully have another discussion at the next meeting. And Donna, I'm not sure if Donna's going to be back by then, but I'm sure she can probably join us virtually and just go over the regulations and just make sure everybody's good with them to move them forward.
Okay. Do you know, just from your conversations with her, does she have any specific recommendations as far as updating these? What, what's not good, what is good?
She likes the regulations as presented, as you received for tonight's meeting. She hasn't made any changes to it. She did review them ahead of time. I know Raj and Laura and myself, we just had a quick conversation. We had to ask Donna to clarify something for us because none of us knew the answer, and she was very good about letting us know. But I know Raj has looked at them. Of course, Laura has looked at them. So I think in general, they're ready for the other board members to just look at them and feel comfortable with them. And just another keynote, because I know that I'm a visual, and when the Larkridge Lane came in front of us the last time, we all are absolutely entitled to go on site visits at these properties, any of them, septic, animals, whatever, prior to a meeting to make sure everybody's comfortable. So if you need a visual on any of the stuff that you can always go by and take a peek at any of the properties that we issue permits for. And Laura can help you with addresses if you need them.
That's great. Well, yeah, thank you for reviewing those and your effort already, and it'll be on the agenda to review next time as well.
Great, thank you.
All right, thank you. So as far as the consent agenda goes, would anybody like to, make a motion to accept these, excluding the appointment of the burial clerk as recommended by Diane previously in the meeting? So at least for A and C. Or
we're
do we
going
need to make
the burial clerks to the next meeting?
Okay, correct. And I will do that as well.
Right. I make a motion to approve the consent agenda.
Any seconds?
I second.
Barbara, thanks, Barbara. All in favor? Aye.
Hi, Diane.
Ron?
Aye,
Jay?
Bernadette.
And Jay, just so you know, you might have seen this for other boards agendas, is that the consent agenda is more of a notification, like, even minutes, everybody hopefully had a chance to review them. make any changes to them, let Laura know prior to the meeting. So it's more about notification. And if there's anything in there that you feel that you wanted to discuss, just, just call upon the chair to pull it out. But in general, it's on there just to kind of move those items forward.
Okay, thanks.
Okay. Thanks, Diane. Moving on to 10, Rajit, Health Director's agenda.
Thanks, Dr. Ron. So the first one is arbovirus report. So I have sent both the last 2 weeks reports to you. The report we got from DPH on 7/10, that was last week, we had one positive case that was in Medford area for West Nile. Now, these are water sample test positive results. But I guess because of the rains we have, the report we got yesterday, there are 12 water samples that are positive for West Nile now, and this is most in our area, like Middlesex, Barnstable, and Suffolk counties. So right now there are 12 positive water samples for West Nile. Good thing is there is no human cases so far for both West Nile and Triple E. So that's one. On the same note about the abandoned pools, we had 2 abandoned pools that came to our attention in Ashland. We got both the pools treated by the Central Mosquito Control Program, so they come and do these treatments for the pools that they're good for the whole season. So both of the pools was treated by them. And we have issued administrative letters to the owner of both the pools to drain the pools and secure it, because these pools been sitting out there for the neighbors are telling both the pools are out there for 5 to 7 years, they are abandoned. One of the owners have already reached out to us and they are securing the pool, and the other one, the owners are in Maine and we have served them a notice, but hopefully get a response from them. So this is, we are on the abandoned pools, but we'll ask the public, any board members, if you are aware of any other abandoned pool in Ashland or around, please bring it to our attention so we can get it treated and then secure it, given Ashland is in critical phase, because of the 2019 case here in Ashland is still in that range, so hopefully we are looking, we don't get any cases, even water cases here, but any inputs on that, please bring it to our attention so that we can get that treated. The last item I have is the Metro West Shared Public Health Grant, fill in the gap grant. I briefed the board a little bit. We're getting more information on this. There are 6 towns involved in this, and there is $300,000 funding from the DPH for the next 3 years. And we are in process of putting the jobs out for these positions. And Mr. Chair, I have to get your signature on that, because that document is a commitment letter that has to be signed by the town manager and yourself so that we can send it to DPH.
Okay.
Any questions for me from anybody, please? Yeah.
Do we need to vote? Do we need to vote to authorize Ron to sign that agreement? Is that to enter? And I apologize, I should know this, Raj. You gave it to me for my daytime job. I can't remember. I just didn't know, should we?
Yep.
I don't think we need to, right?
I don't think so. It's a letter of commitment saying that we're going to be part of it and participating in the grant. I am not 100% sure, but
how about I make a motion? How about I make a motion just to cover us? I don't know if we need it, but okay. I make a motion to authorize Ron, the chairman of the Board of Health, to sign the Metro West Shared Public Health Service Grant. Good.
Any second?
Second.
Thank you. All in favor? If we need it. Hi, Ron.
Diane.
Hi, Jay.
All right.
Hi,
Barbara.
Okay, great. All right. Well, thank you. Okay. So looks like that brings us to, the next meeting. We already have a few things.
if we could move if we could have the meeting on the 17th, I am away on vacation. I shouldn't be
Yeah,
publicly
no, and I
announced.
think that's great. I'm good with that. Does that work for everybody? Or at least if we get 3, because we try to do the one, and that doesn't really make sense for us to have one next week, right? Which would be, is that next week already? Oh, no, it's still 2 weeks away. Yeah. So is everybody good with the 17th?
Yeah, I'm good.
Okay.
And then I'm assuming starting in September, we're going to get back to the 1st and 3rd.
Yeah, and we can actually, we're cleared to still do those in person, or is that still on hold?
Yep.
Yeah, we are. Okay.
Yeah, I was going to mention that because the select board is having their first hybrid meeting tomorrow night. So they'll be physically in person at the select board meeting room, as well as they have it set up upstairs that that people can log in through Zoom. So we had a test run today, another test run tomorrow. So I don't know that we need that, but I mean, for the new board members, I mean, in general, our meetings are televised live from WACA through the select board meeting room on the 2nd floor. So that's, if everybody's comfortable with physically meeting in person, we can go there for the meeting in September. If everybody is not comfortable, we could do the hybrid model, and some do virtual and some be in person. So it's a discussion we should have.
Okay, I'll put that on for our next meeting. Person or virtual.
And because I always have something to say, I wanted to mention too about September is that, I think because, we're all getting to know each other, I think it might be worthwhile having I know the select board calls it a retreat. I don't want to call it a retreat, but maybe a casual meeting in the lower level of the town hall, which is open to the public, but maybe not televised, and just kind of all sit around and maybe talk about, again, if everybody's comfortable in person, maybe talk about like what our goals and objectives are for the next year. We've done this before. We order a couple pizzas and, sit and just talk about, or salads or whatever people want. And we pay for it, just for clarification. And just, and just talking, because everybody, like I had the regulations, somebody else might want to look at the well regulations, or like I know KG liked the permitting system. So everybody has their own passions. So if we sit maybe around a round table and everybody take some projects, if you will, and again, I know Ron and I used to attend. We mentioned it earlier at the meeting. Ron and I were attending the decisions at every turn meeting. Somebody else might like to take that this year, or get involved with something else. So if you want, maybe we could talk about that for maybe the second meeting in September, if that works, or first one. I don't really care. I just think it's healthy. It was fun. We usually have a lot of it's a fun meeting.
No, I think that was a great idea, and it is good to do that. So yeah, we'll put that on there as well. And Di, this is just for you, because I don't want to put it on if we don't have to do any other talking, other than if you think it's worth revisiting. A heck of a lot more about the local Title V regulations as compared to the state regulations. Seems like most of the waiver requests that we're getting are for our own town regulations. Is there, with this newer technology, is it worth us revisiting that and attempting to revise that? And is that something that we do, or is that another town official that does that? I know that we enforce them, but do we also write them? What are your feelings about that?
So I'm going to pass it off probably to Raj, because I mean, yes, it's our regulations, so we would go through the same process. Okay. I know that, I mean, it's really, I look at the Raj and Tom here, because I mean, we do most of the time give a waiver from the septic design. So I agree. It's like, should we incorporate that in the regulations so people can like move through the process? I really would lean on the two professionals on that. I know we tried to do that with, authorizing the director to sign certain permits, again, to keep things moving forward. Same thing with the animal regulations, so people don't have to keep coming in front of us and waiting for these things. I think it's a very healthy discussion. I just don't know if it's, if Raj is ready to jump into that yet. And, Tom, your thoughts on it as well.
Yeah, Tom, what do you think?
Rod, you want me to start? I'll start by saying that the Title V, if the board is going to consider having a regulation, more regulations, it actually is a public hearing where you would have to notify 2 times in the local paper, and then before the meeting, pretty much start for the record the reasons why. And that's the typical regulation that you would have to, if you create a typical regulation, you wouldn't have to do this notification up front.
If that's for Title V though, but not if we update ours, correct?
Right. So for upgrades to the Title V requirements, you would be required to publish in the paper twice. And I think it's summaries of the regulations, and then hold the hearing, and then you have to publish it again afterwards in the paper. And I think you have to put it on I think you have to post it too in the local town hall.
I hate to be so literal, but that's if we were to adopt any of the Title V regulations in our regulations, because we don't have the Title V we're not gonna, we're talking about our own local regulations.
Anything in addition to Title V requires that. So a typical, if you're doing a well regulation, it doesn't apply the same standards. For some reason, the lobbyists were able to get in the law that if the Board of Health requires more than what's in Title V, they have to publish it in the paper twice, hold the public hearing, and then publish it again.
Yeah, I do remember doing that before. I just didn't remember if it was yeah, okay.
Yeah, yeah. And the other regulations, you don't have to do that. You just need a public meeting to do so. So
just to add on, I guess, Mr. Tom, these new things are very recent, right? Like for the Title V, the systems that they are putting over the conventional, that they are newer technologies, correct, right?
So the technologies are a little bit different. The DEP has created a mechanism. When they started in 1995 by creating a mechanism to approve technologies and grant typical waivers, saying that it's at least as good as a conventional system, but not as good as a sewer. So they have testing sites, and they go through procedures where the DEP reviews technology and then writes up an approval letter granting, such as the Elgin, for repairs only. A 2-foot offset to groundwater is allowed, or a reduction in size, or reduction in offset in naturally occurring material. So they go through an approval where the Board of Health is allowed to grant these without going through a local upgrade. So Eric was right that one of the local upgrades really wasn't a local upgrade, but he put it in there as notifying the board that it's going to be a 2-foot offset to groundwater. Elgin is approved under repairs to do so, but he was just putting it out there as well that it's typically a 4 feet. I'm going for 2 feet. So
I would just say, I would say that we should probably stick to the regular procedure that we have for now.
Okay.
That's just no real reason.
No, you know a lot more about it as Rajit. Obviously, Tom does this, so he knows. I didn't know if it would take a little bit of stress off us to have to grant these waivers, even if we left them the same, but added the newer, let's say, DEP recommendations for the Elgin system. Even if we still had to do something, maybe instead of granting 6 waivers, we only have to grant 2 for one property. I don't know if that's worth it either. I certainly don't want to push it. I just didn't know if it would, make everybody's life a little bit easier, because to me, I certainly know nothing about it. I know a little bit about what the regulations are, but personally, I don't think I have the knowledge to be able to tell somebody that, yeah, they should or shouldn't do this. So if the DEP says it's fine and civil engineers are designing these things in accordance with the current regulations, I'm not going to tell them that they're wrong to do it. That's for sure. So if they're recommending it and Raj is okay with it, because I know he knows this as well, I don't think we're ever going to not, grant any of these waivers because they're replacing septic systems that aren't functional or that are so old and outdated that whatever you do that's new is going to be a million times better than what's there. So I think that benefits everybody. And I'm happy to keep it the way it is, Ty, but
Tom, what do you think?
that was just my thought.
I'm just gonna ask, obviously Raj can put in his 2 cents, but I just wanna.
Yeah.
Yeah, so as far as repairs, I totally agree that there are some of these requirements are a little bit difficult under repair conditions, but under new construction, it provides a little more wiggle room in just in case the system fails to, like the 10-foot separation. They can always utilize in between the trenches now. They have better mechanism, better ability to provide trenches under repair condition in the same location without having to dig up the whole yard. So theoretically, when they put the trenches in, they'll when they first construct it, theoretically they're going to be at the same elevation pretty much when a repair, hopefully not for another 50 years, is needed. So they don't have to go out into the woods, dig more soil testing, and so the existing regs are good for the new construction. As far as repairs, it's always good to have an ability to waiver when you can't meet those requirements.
So could we make a specific section in our regulations for, we call them repair or replacement of an existing system, and allow certain, I'll call them what our normal variances are, and give, for example, let's just say we allow up to 10-foot spacing in between trenches. And so we would add like a section to allow up to, like, could we add sections like that and just.
Yeah, so but then again, once you open that up, you still have to go through the process.
About the public forum.
Right.
Yeah.
Yeah.
Okay.
Is it something that you can work with Raj and you guys can look at it and make a recommendation to the board? Because you might, obviously, you've both been on the meetings for a few times. You might say, okay, listen, in the last 6 months, you've given, 10 waivers for the garbage disposal. Why don't you just allow them under the code for repairs, not for new, if we had maybe a section just for repairs, and added a new section. Of course, we can go through the process, but if you guys can take a peek at it and let us know, and also to make it easier for the two of you, for your review and, Raj's approval, if it makes the process easier for you guys to be able to stamp a plan to allow somebody to do that. And again, it's kind of the comfort zone for you guys too.
Right.
What you're comfortable with reviewing before it should come in front of the board for a full review or full waiver.
Right. Yeah. Raj and I, we could talk about that. What is, what we suggest should be before the board and what could be done in the office. Like you said, like a garbage grinder, if they come in with the deed restrictions, I've recorded this garbage grinder for repair. That might be easier to handle in the office, for example. Right.
Yeah.
And I will look into the stats, how many waivers we have given in past 1 year, supposedly, we'll look into all that and then come up with the numbers and, where we need to look. So.
And hopefully by that time we'll be done with the animal ones and moving on to the next ones.
Yeah. Right. Okay. So I won't put that on, and then, Raj, you'll let us know whenever you're ready to talk about it and we'll throw it on the agenda.
I will, Dr. Ron, yes.
Hey, thanks, Tom. We appreciate your guidance, along with Raj. Thank you.
Thank you.
Okay. All right. Anybody else have anything else they may want to talk about, or is it time for the most important motion?
Well, I just wanted to say, sorry to Jay, I missed your introduction. Welcome to the Board of Health.
Yeah.
Thank you.
So, yeah.
I appreciate it.
Yeah.
Since you're unmuted, you can make the motion for the most important part of the meeting, Barbara.
Yeah, there you go.
Anybody else for that matter.
Right.
Okay, so I'm making a motion to adjourn the meeting at, what time do I have?
Okay, excellent.
Sorry.
Anybody second that?
It's not working. 7:12.
Yep. Second?
Second.
Okay, all in favor? Aye.
Hi, Diane.
All right.
Hi, Jay.
Anybody need to talk about anything else? Give me a
Good
call
job,
or
Ron. Have a good night,
we'll
everyone.
get it on. Thanks,
All right,
Diane.
good night.
Everybody
Thank you.
have a
Bye,
good month and
everybody.
we'll see you on the 17th.
Have a good night, everybody.
Thanks,
Thank you,
KG.
Ron.
Bye.
Thank you.
Bye.
Good night.
Thanks, Raj.
Thank
Yeah.
you, thank you.
Thanks, Laura.
Thank you, Ron.
Bye.
Good job. Thank you.
Thank you.
See you around.